Clavamox, amoxicillin clavulanate, is one of the most widely used antibiotics in feline medicine. Still, understanding which clinical signs or diagnostics, such as positive bacterial cultures or specific infection symptoms, are sufficient to justify its use is essential. In this video, you'll learn the exact clinical situations where Clavamox is recommended in cats, along with proper dosing, treatment duration, and safety considerations every veterinary student must know. Clavamox, amoxicillin clavulanate, is one of the most commonly prescribed antibiotics in small animal practice, valued for its broad antimicrobial coverage and its ability to overcome beta-lactamase-producing bacteria. Understanding when and how to use Clavamox is essential for veterinary students preparing for clinical rotations or licensing exams. Clavamox is indicated for various bacterial infections in cats, including skin, respiratory, gastrointestinal, and urinary infections. Knowing these helps you make informed decisions and feel more capable and prepared in clinical situations. Clavamox plays an essential role in the treatment of gastrointestinal infections caused by susceptible bacteria and in urinary tract infections such as uncomplicated cystitis due to E. coli, Staphylococcus, or Streptococcus species. Dental and oral infections, including gingivitis, stomatitis, and tooth root abscesses, are another common reason for prescribing Clavamox. It may also be used as a post-operative prophylactic agent in select cases, particularly following dental procedures or contaminated wound management. The recommended dose of Clavamox for cats is 12.5 to 25 milligrams per kilogram orally every 12 hours. 12.5 milligrams per kilogram every 12 hours is the most commonly used regimen. Treatment duration generally ranges from 7 to 14 days, depending on the severity and location of the infection. Incorporate guidance on monitoring clinical signs and response to therapy, such as reduction in inflammation or bacterial load, to help determine whether treatment should be extended or shortened to achieve optimal outcomes. Understanding how to assess clinical response and when to consider culture and sensitivity testing can help determine whether treatment should be extended or shortened to achieve optimal outcomes. Clavamox is typically well tolerated, although gastrointestinal signs such as vomiting or diarrhea may occur. Be vigilant for rare adverse reactions, such as allergic dermatitis or hematologic changes, especially in cats with known hypersensitivities or renal issues. Caution is required in patients with renal compromise, and the medication should be avoided in cats with known penicillin hypersensitivity. As with all antimicrobials, ensuring completion of the full treatment course and promoting judicious use are critical for preventing antimicrobial resistance, helping you feel confident in safe prescribing practices. If you are a veterinary student, you can now join our veterinary review lectures for only $2.99 per month. These review lectures are available only to members of our channel.